We're going to release the adductors, the inner thigh muscles. You are going to start with the soft ball. Let's start with the really soft blue ball because we're going to release gracilis, and is a very tender spot. I promise you, it's a very tender spot. So have some blankets nearby, maybe stack a couple of blankets like this for a little pillow, so that you have a little support under your head. And then you're going to lay on your right side. So here we are, right side. You can take your box or a yoga block. And then the bottom leg just kind of gets out of the way. And then the top leg, now notice your box or your block has different heights. You're either using a yoga block down like this. For this first part, I recommend that you have it on the lowest height. Then you're going to slide that underneath the top thigh. Okay, so it's just like you're sleeping on your side. And then you're going to take that soft ball, the nice squishy soft ball, and you're going to go about halfway between the knee and the pelvis. Halfway between the knee and the pelvis. And that is where we begin our inner thigh work. And you drop the inner thigh down on that soft ball. And just start making a little bit of circles, swirling around a little bit, rocking a little. Top hip rocks forward and back, and forward and back. And what you're doing is kind of cruising along that gracilis muscle, inner thigh. Ah, so good. And if you look, you get about halfway between the knee and the pelvis, and there's a very tender spot right there. So stop moving. Sink your weight down, that leg down in. Now, if you are halfway, and you should be halfway also from the front and the back. So if you're using a really high block, you might need to lift that foot a little bit to align the thigh onto the ball. Couple of breaths. Now, gracilis is a knee bender, among other things. It's an adductor, draws the thighs in toward each other. So you could play with straightening and bending that knee, just sweeping that foot through a path. Straighten and bend. And you're going to bring more excitement into the point as you straighten. And then as you bend, it's going to kind of back off. And that little movement right there really helped to clear my tension in my gracilis. So from here, we're going to move up the thigh. And we're going to go now half again. So we'll be about 25% down from the groin. At this point, you'll want to flip that box up or flip your block, your yoga block up. Get the ball in. And go right through. Now, as you go higher, you might have to make a little more effort keeping the foot lifted to keep yourself aligned on that inner thigh area. And you might find that as we get to this part where there are more layers of tissue, we have several adductor muscles stacked on top of each other here, you might find that the soft ball now isn't quite as effective for some. And depending on what you've done the day before, whatever, you're going to have, this is going to be totally fine. But if you need more pressure, now you can switch to the large myofoam ball. So I'm going to grab that large myofoam ball and put that, so I'm about quarter of the way down from the inner thigh. So basically a few inches down from the groin. Now we're talking. Now I got some really exciting sensation going on there. If you need more sensation, you could even flip it up to even the higher. Boy, that's going to be hard to get onto, right? But you could lift up and get up on there. The best way is to keep it on this second height. And then if for some reason you need more sensation, you turn like you're going to roll towards your belly. And that little bit of turn right there drives more pressure into the ball. So if you have enough pressure just like that, then let that be so. You know, no point in driving in as deeply as you can, or as you're not looking for as much sensation as you can necessarily. Now, these are inner thigh adductors. They just strictly draw the thighs toward each other. So our movement would be just like pushing into the ball and lifting up, pushing in and lifting up, and just kind of slowly bounce a little on that tissue. And then after a few breaths, a little bit of movement, not beating it to death, you're going to go up so that you're kind of bumping into the pelvis. Bumping into the pelvis, you're as high up in your inner thigh as you can get. Bumping up into the pelvis, you're going straight through that thick tendon that's gracilis. And laying that thigh right over there. Now notice the foot drops and rotates the thigh. So pick the foot up and play with that, and then kind of rock that thigh forward and back. Oh, it's so good. And then find a really tender spot. Drop it in. Take a couple breaths. And remember that if you want more pressure, you can rotate yourself. You can lift up onto your elbows and turn like you're going to turn toward your belly. And just that alone, pushing that pelvis, that side of the pelvis forward, drops more weight into that ball. One more breath here. Whew, all right. And then you're going to lay down on your back just for a moment. Drop the knees out wide, feet together, knees out wide. Take 2 breaths here. Always in the belly. Okay, we're going to swing around to the other side. So we're treating, in this short little practice here, gracilis and adductor longus and adductor brevis all at the same time, all in this quick little practice. And it's so beneficial for so many things, not just TFL issues. So I've got my little bin of all my tools right here. And I'm going back to the soft ball because that gracilis is I'm going back to the soft ball because the gracilis, the femur is a little more medial in this area. There's not as much tissue between the ball and the femur here. And if you have more flesh, if you have bigger muscles, if you have more fatty layer here, you might want to use a firmer ball. You just play around and find which ball is just the right one for you. So we're going into halfway, and I'm going to start on that lower side, right? Because gracilis is more superficial. And we're looking for halfway between the pelvis and the knee joint. And so we just do a little kind of circling and rocking in and out of that tissue. You get to that halfway point. Sink in right there. Yeah, there it is every time. Halfway, pelvis to knee, gracilis. And then we can start the swinging, right? Straighten the knee and bend, and straighten and bend, straighten and bend. We only do the straightening and bending here on the gracilis. The other adductor muscles don't act on the knee, so it wouldn't really change it much if we did this on the other muscles. It's so much better now, so much better. Remember, if you're not totally finding it, you might drop the foot or lift the foot, and that's a way that you can play with rotating that thigh so that you can get real specific on that point. So now I'm going to move up closer into adductor longus and brevis. I'm going to flip the block. You can flip your yoga block or flip your box that your tools came in. Find a firmer ball. Find a firmer ball. Go up now another couple inches so that you're closer to the pelvis. And you might slide forward and back. Check the height of the foot relative to the knee. You can lift the foot up or drop the foot down. That's going to rotate that femur on the ball and adjust where the ball is pressing into in your tissue. So good, right? And going right through that thick tendon, it's great. A great place to start. And then you might go just a little bit behind it or a little bit in front of it by lifting the foot and find just that sweet spot where it feels really exquisite or really like an important point. And then you sink. Relax your jaw. Relax your eyeballs. Check your tongue. Is it stuck up on the roof of your mouth? Soften it down. Now we're going to get right up at the groin. So we're just getting the ball. You can't go any higher up because it bumps into the pelvis. And sink down. If you want more pressure, what do? You can start turning toward your belly. Just that little bit of lifting. See how it pushes my weight right down onto that ball. So if you want just that little bit more pressure, you can kind of lift that left hip up, drive the right thigh down onto the ball. Take a couple of deep breaths. You can push in and lift off. Or you can just lay down on it, relax, and sink. Check the angle of the foot. Great. Then we're going to move off. You're going to lay onto your back, knees bent, feet on the floor. Drop the knees out wide to the side. Another big breath in the belly. Now we're going to come all the way up to sit with the legs out wide. All the way up to sit, legs out wide, to do what I call the flip-flop. So in the flip-flop, let me push that box out of the way. In the flip-flop, you are using those inner thighs. The inner thigh muscles not only draw the thighs toward each other, but they also rotate the thighs inward. So we're just kind of moving them, working that rotation, using the muscles to clear out the hip joint and freeing some of that communication between the inner thighs and the outer hips, gluteus minimus and medius. A couple more breaths here. Keep going. You're kind of shaking out. Let your thighs be as kind of wiggly as they can get. And we're going to do this for 5, 4, 3, 2, 1. Relax. Feel the energy flowing through your legs and your feet. And that's freeing the adductor inner thighs, except adductor magnus. And that's in the next video. We're going to do a special adductor magnus release.